Good afternoon, Carlos.
Hi,
Dr.
good
Carlos,
afternoon.
how are you?
Very well, very busy.
Carlos is the chairman of the Queen Sofia Spanish Institute and the cornerstone for us and for the leadership of this organization. And he not only chairs our institute, but is a formidable part of the United States medical community as head of pathology for Mount Sinai, which is a group of 8 hospitals that employ approximately 9,500 doctors and is the epicenter of, unfortunately, what we all are living through, which is the pandemic of the COVID-19. Today, Carlos, I'd like to ask you a few questions about your viewpoint as a medical professional, a scientist, and leader of our institute. Is that okay?
Absolutely, thank you. Thank you.
Thank you so much. The question that first comes to mind, Carlos, is simple. Could you explain where we are right now in the fight against COVID-19 in the United States and in Spain and in the world?
So I hope that we are at the beginning of the end, and maybe to quote Churchill after one of the most important early battles of the Second World War in Europe, and he says, "This is not the end. This is not the beginning of the end, but this may be the end of the beginning." And maybe we are there. We are maybe close to the end of the beginning. We have seen a pandemic that is spreading throughout the world, a virus that it's new. We have not seen this virus before, that has high infectivity, that is very efficient in infecting, and that is producing what we think is a new disease, and we can discuss that further. But the reality is that of the same family of the influenza. It's a coronavirus. It's very similar to the flu, but it has its own connotations. And since we have not seen this disease before, nobody was prepared with the natural antibodies that the body has produced over the years and over the generations for diseases that we have seen before. And since we have not had the time for a vaccine, we needed to battle with what we had at hand, which was very little. We have learned that the virus, it's mainly tropic, goes into the lungs as the regular influenza, as the regular flu, but also has a specific tropism. It has a guidance to go into the endothelial cells, circulates inside of the blood vessels, and goes into other organs, producing a multi-organic disease that produces organ failure at multiple levels, and it has produced the death of many of the patients that have had the disease. Fortunately, there are also many patients that build their own antibodies. We have therapies of support that have helped, and the death toll has been higher than a regular influenza year, and we hope that we learn from this experience, because this disease is here to stay. This is not going to go away, and we need to learn how to protect ourselves, protect the society, and slowly but surely open the gates whenever is going to be the right time, and go back into a life that we used to know that for sure is going to be impacted after what we have seen during these last few months.
Would you dare to guess when we will have the vaccine available?
Vaccines are not easy to produce. The rate of success is not very high. Some of my friends, experts, say that that of every 100 vaccines that you may try, 6 or 7 are going to work. There are many of them already being tested. We think that a vaccine is probably going to be here in a robust way with sufficient immunizations for general populations, probably in a year from now, probably before the summer of 2021.
Thank you. What, in your opinion, Carlos, would you say are the differences between the situation facing Spain in the battle of COVID-19 versus the United States? It seems to have a different demographics in its victims and in its impact. Could you please expound on that?
Yeah. So in general, what we have seen is that, like the regular influenza, the regular flu, um, individuals at high risk are the ones that have a more severe disease. So the elderly individuals with other comorbidities, high blood pressure, diabetes, um, smokers, past aggressive smokers. Um, in this situation, one of the good news is that young people and essentially infants and um, young adolescents have been quite spared, which is a blessing in that context. And we are trying to understand what are the causes. We have seen not very dissimilar number of individuals at specific groups of age in the different countries. Maybe what it has been a little bit different is how the different governments or the countries have been able to address the disease from the very well beginning. It has been very frustrating for all of us. It was a new entity. We didn't have the tools that sometimes we have. When tools were available, it was difficult to escalate. In the laboratory, it was not easy to start testing everybody. The chain supply was very limited, but we caught up with it. The numbers are now reversing. When we were testing for the presence of viruses some weeks ago, 70-80% of all of the tests that our laboratories were doing were with the positivity of detecting the virus. Now this is not the case. In the last couple of days, the number of positives are around 10%. So really we have reversed the equation. We also have observed that over the time, the individuals that have been sick and a subpopulation of our community that have been asymptomatic, they were not feeling very well and they never really were tested, but they have antibodies. So now what we are seeing is the reverse. The population is starting to have antibodies to fight against the disease. And what we have seen is that most, if not all, of the patients that ended up doing well with their disease have antibodies, the antibody titers, which is a measure of how rich your blood is with immunoglobulins and antibody to fight again if you see the virus, are quite high. And as a matter of fact, we are using some of these very high titer, very antibody-rich individuals to take their blood, to isolate these immunoglobulins and to use it in patients that they are very ill of the disease, and it's helping. And it's a treatment that has been used in the past and has worked.
Thank you. With respect to the COVID-19 and the strains, there's a lot of information that there are strains that came directly from China to Spain and Italy, and those came to New York and the East Coast, and others to the West Coast. Could you clarify the mutation, these strains, and how many are there, and are there different ones in these different areas, please?
So in general, coronavirus, the family of the flu and of COVID-19, of the SARS-CoV-2, as we call it, the virus, are not very highly mutagenic. HIV, for example, that produce AIDS, it's a much more mutagenic virus. And maybe for that reason, it has been difficult to produce a vaccine. We have seen, of course, some mutations, but the mutations that we have seen are not producing the disease so far that it's more difficult. I try to sometimes to compare, the things that they are really essential and can produce a difference, and the things that they are a little bit more in the context of nature, but not necessarily critical for development. So we all have different blood group antigens sometimes, but the blood is the same, and somehow these kind of mutations are not as critical as if you have a mutation that can predispose you to cancer, for example. So some of the mutations that we are seeing in the virus are mutations to have a difference in the genetic code, but not necessarily a difference in function. That said, the disease that spread from China initially into, towards West and into Europe, produce some changes, and at least the virus that we have in New York, that it's mainly the predominant viruses in the United States, it's not of Chinese origin. It's a virus that was brought here mostly by somebody that was in Europe and brought the disease from Europe. So the disease that we are seeing is very similar to that of China, but by a strain that was originated in Europe. And we have seen some mutations in here, and there are groups that they are studying that, both in this institution, at Mount Sinai, at NYU, and other groups. There was a very nice publication that essentially produced this knowledge that the virus that we have in here comes really from an European origin, but it's not more malignant or benign than the one that is in China or in some other countries.
Thank you. And lastly, Carlos, as chairman of the Queen Sofia Spanish Institute, this pandemic necessitated the need to cancel all of our activities in 2020, including the Sofia Luncheon, the Translation Prize, numerous lectures, and concerts. How do you see the future for culture?
Well, I think that life as we have known it may change. I was talking to my children and I convey that message. My son asked me, are we going to go back to see a nice soccer game? Are we going to go back to, the restaurant that we like, to the cinema that we like, to see a concert? And the answer is yes, but it may be different of what it has been until now. We will learn that through this pandemic, some of the habits may need to change. We may need to be more protective of ourselves and of the community at large. We are learning that maybe some traveling and some specific gatherings can be avoided by new technology as the one that we are using right now. We may have more time to be with our family and some close friends. And time is a constant. Time is not a variable. We all have 24 hours a day. It's how we use it that it's important. And maybe we are going to learn how to use the time more wisely.
Well, thank you for that piece of wisdom, lots of wisdom. So without further ado, Carlos, thank you very much. And I hope that we can have talks like this on a more regular basis every 2 weeks to keep our patrons and public aware of your progress and the world's progress, because we're all in it together. Thank you.
Thank you very much.
You're
Stay
welcome.
safe. Thank you.
Okay.